Scan protocol. Role of ultrasound. To assess the 1. Size. 2. Shape. 3. Texture. And 4. Vascularity of the spleen. The spleen is a parenchymatous organ located in the left upper quadrant of the abdomen, in the splenic lodge. The ultrasound examination of the spleen is better performed in a fasting patient, in supine right lateral position, using an intercostal approach, with a 3.5 to 5 megahertz transducer. Due to the high position of this organ, covered by the ribs, inviting the patient to take a deep breath could be useful. Patient preparation. No preparation is required. But, you usually need to avoid food and drinks for 8 to 12 hours before an abdominal ultrasound. This is called fasting. Fasting helps prevent gas buildup in the belly area, which could affect the results. Ultrasound appearances of the spleen. The spleen has a homogeneous appearance. When it becomes enlarged, it loses this shape and, as it expands, it becomes very rounded, sometimes appears extending beyond the left kidney. Normal adult spleen size, less than 13 cm, superior to inferior axis. 6 to 7 cm, in the medial to lateral axis. 5 to 6 cm in the anterior to posterior plane. Average volume is approximately 350 milliliters. The spleen is considered enlarged if it covers the entire left kidney. Be prepared to change focal zone position and frequency output of probe or probes to adequately assess both superficial and deeper structures. Common pathology. 1. Splenomegaly, greater than 12 to 14 centimeters or volume greater than 500 cc and becomes rounded. 2. Infection, multiple echogenic foci, granulomata. 3. Hemangioma. 4. Cysts. 5. Metastases. 6. Lymphoma. 7. Varices, portal hypertension. 8. Hematomas. 9. Intraparenchymal, subcapsular and pericapsular abscess. 10. Splenic infarction. Scanning technique. Start with the patient supine. Scanning the spleen with the patient decubitus often increases the risk of bowel gas and lung base, obscuring the view. Place your hand and the probe on the bed to visualize the spleen from a posterolateral approach. Angle the probe between the ribs, intercostally. Rotate the probe to be parallel to the rib space to maximize your window. Overlying bowel gas, overlying lung base, or rib shadows can cause problems. To improve visualization, change rib spaces or slowly roll the patient. Improving visualization, try inspiration, expiration, distended abdomen, erect. Rarely the left lobe of the liver, if enlarged, may be used as a window to assess the superinterior portion of the spleen. Tips. 1. If you can see the left kidney but cannot see the spleen, simply slide the probe superiorly. 2. The most common mistake when beginning is not being posterior enough. Limitations. A small spleen may be high under the diaphragm and difficult to assess. Bowel gas may obscure the view. Normal variants as constant the spleen are, small spleen. Asplenia. Polysplenia. Splenunculus. Splenic artery calcification. Study ultrasound easily. Like, share and subscribe.